In today's Tech Talk, we will be discussing blockchain and healthcare. The objectives we would like to cover in this presentation are: what is blockchain and how it's being used in healthcare, discuss how Actual and Encryption are using blockchain to innovate the healthcare space, compare the business models of both companies, and provide final conclusions on blockchain and healthcare. So what is blockchain? Blockchain is one of the most intricate and complex technologies out there. It can be defined as a ledger of real-time transactions where encrypted blocks of data are chained together by hash to create an immutable record which cannot be tampered with. The data is decentralized and distributed across peer-to-peer networks so that no single person has control of data, which provides enhanced security and creates trust among the users. In simple terms, consider this example. A patient registers for a blockchain address. The patient visits their primary care physician for a routine checkup. The details of the visit are recorded in the patient's electronic healthcare record, which is owned by the patient and creates a new block of data in the blockchain. The patient can then choose to allow insurers and other providers in the blockchain network to access their medical records. Every time the patient visits their provider or another one, the record of their visit will be recorded and added to their entire medical history. This ultimately reduces the amount of time spent filling out paperwork in the doctor's office and provides a more accurate picture of the patient's medical history. The US is expected to see healthcare costs to be 20% of its GDP spend in the near future. There will be many opportunities for blockchain to be disruptive in this space and helping cut costs efficiently. While blockchain has not reached its full potential, here are some ways it's currently being used in healthcare: pharmaceutical supply chain, provider credentialing, patient drug management, claims adjudication, and patient data management. Next, we will discuss some real-life applications of how blockchain is being used in healthcare.
Thank you, Josh. The first company that we're going to be discussing is the company Actual. Actual is a workforce intelligence network for healthcare that streamlines workforce deployment, drives efficiencies, and maximizes revenue. If you're familiar with the current traditional healthcare system credentialing process for practitioners, you know that oftentimes is very slow, painful, and time-consuming. This is because practitioners must track down many different documents, and the medical facilities and the insurance companies also have to take time to review this information. Because the traditional credentialing process can be very slow and time-consuming, this can lead to decreases in patient access to healthcare, decreases in revenue, and can also lead to increases in practitioner burnout. Actual addresses these issues by providing a digital fabric that connects the credential issuers, holders, and subscribers to create an up-to-date, ready-to-go set of credentials, providing a faster and more efficient privileging and pay enrollment process. So how does it work? Practitioners will set up what's called a digital wallet. This is free for practitioners. This consists of a digital ID and digital credentials. The digital ID is set up when a picture is taken of the practitioner's physical ID as well as a selfie of themselves. They'll upload this to the Actual network, and the Actual network will apply ID document and facial recognition to compare the photos and confirm a match. The digital ID is combined with further information provided by the practitioner to query and gather credential issuances from places which match the profile. As new credential offers arrive in the practitioner's inbox, the practitioner can review and can accept them into their digital wallet. Once a digital wallet is fully up to date, this can be easily shared with organizations. Organizations must be subscribers to Actual or are a similar service which complies with W3C worldwide standard for digital credentials. Subscribers can now confirm the validity of a practitioner's credentials by comparing the digital signature and seal surrounding each with that of the authorized primary source issuer. Actual is powered by highly secure and tamper-proof permission public blockchain, digital wallet infrastructure, proof life cycle trackers, and primary source verification engines. Actual can help save time and eliminate repeated efforts. Ultimately, this can lead to increases in patient access to healthcare, increases in revenue, and decreases in practitioner burnout.
Before diving into our next company, Encrypgen, we wanted to provide a little bit of background. In 2013, the US Supreme Court ruled on a challenge to patent genetic testing which stated that segmented natural DNA is not patentable. This made owning genomic data, including your own, virtually impossible. This is important because genetic data holds highly sensitive information that could easily be misused by various organizations or the government, leading to real-life implications, such as potentially making it difficult to secure health insurance if you're genetically predisposed to certain diseases. But on the flip side, genomic data is crucial for scientific purposes. There are instances where genomic data is publicly stored, and though the data is de-identified, a recent Harvard study showed that it could be easily re-identified, linking each data set to a particular individual. EncryptGen developed a technical solution to work within the law to provide property protection for people's genomic data, which is anonymized using blockchain technology.
EncryptGen is the first and only free market of genomic data powered by blockchain. They refer to their blockchain as the gene chain and use the blocks of data as cryptocurrency called DNA tokens. With this system, EncryptGen is democratizing and decentralizing scientific data while also allowing individuals to benefit monetarily through their contributions to research. EncryptGen primarily focuses on attracting individuals who have already had genetic testing done and allows them to upload their raw DNA data file to create a gene chain profile. EncryptGen then makes the raw DNA data anonymous by dissociating it from personal information and encrypts the data within a block in the gene chain. Finally, when buyers of genomic data for research purchase your anonymous DNA information, you receive a DNA token as compensation. These DNA tokens can then be sold on cryptocurrency exchanges, and the buyers of gene chain profile information must also use these DNA tokens to make their purchases. EncryptGen's model offers many benefits to users as well as healthcare at large. The company encourages contribution of genomic data as individuals will be more likely to provide their DNA information thanks to the privacy, security, and potential compensation afforded by EncryptGen. By inciting more amassment of genomic information into a database for use by scientists, EncryptGen has the ability to greatly benefit society through assisting medical research. Additionally, EncryptGen is the only marketplace for the sale of DNA data that is democratic, decentralized, and built to distribute the proceeds of genetic material to those who actually contribute the data rather than only those who compile it. This is vital because Wall Street is monopolizing genomic data, with Blackstone having purchased a majority stake in Ancestry.com for $4.7 billion, and 23andMe having merged with a Richard Branson SPAC to go public at a $3.5 billion valuation. Now is a perfect time for EncryptGen to have entered the market and provided an alternative DNA collection service.
Actual uses a subscription-based model in which they directly contract with subscribers, such as healthcare facilities, in order to access the credentials of the data providers. However, the service is free to the providers themselves. As for EncryptGen, the tokenomics of their DNA token will have an effect on its value only with a growing user base in the range of tens of thousands of individuals. In March, they sold bonds in order to raise funds to jumpstart that user base through direct advertising to a target market of 50 million individuals that have already done genetic testing through giants such as Ancestry.com and 23andMe. Here, you can see an outline of the business model where customers sell their data to researchers through EncryptGen in return for DNA tokens. You can see that the ancillary parties are the genetic testing vendors and token exchanges.
In conclusion, blockchain is a revolutionary technology with a lot of broad and beneficial applications, especially in healthcare, as seen here with Actual and EncryptGen. Patients can have full control over their healthcare data using blockchain technology, even profiting from this data. Healthcare providers can provide better healthcare while also increasing revenue. Built on peer-to-peer technology, secured data is available everywhere at any time, and it's virtually unhackable. In terms of development, blockchain is still fairly young, but with major tech giants like IBM and Microsoft investing heavily in blockchain technology, the market is expected to continue to grow. Worldwide spending is expected to reach $11.7 billion by 2022, with revenues estimated at $20 billion by 2024. Thank you.